Dr. Farrant, I'd like you to tell me the likely diagnosis here and your clinical findings.
So the likely diagnosis in this case, I believe, is polycystic kidney disease. The findings that indicate this are this gentleman has a large mass in the right side of his abdomen, which is ballottable, does not move with respiration. I can get above and is also tethered. I therefore believe this to be a polycystic kidney. The gentleman also has a radiocephalic AV fistula on his left arm, which has evidence of recent needling, which would also be in keeping with polycystic kidney disease, and the gentleman currently having renal replacement therapy. He also has evidence of multiple scars on his abdomen. He has a large midline laparotomy scar, which is possibly in relation to a recent left nephrectomy, and he has a drain site scar on the left side of his abdomen. He also has a scar on the upper right side of his chest, which could be in relation to a line insertion for previous haemodialysis.
Okay, thank you. Putting it all together, why would you think that he's had a left nephrectomy?
So this gentleman, I believe, has had a left nephrectomy, possibly in preparation for a renal transplant. The reason for having the left nephrectomy prior to a renal transplant would be to debulk the area, as this gentleman's right kidney is severely enlarged, and if there was a left kidney present and a left-sided renal transplant implanted, the bulk of the left kidney could impair the function of the left transplant.
What's the cause of polycystic kidney disease?
So polycystic kidney disease is a genetic condition, classically transported via the PKD1 gene, which is autosomal dominant. There is also the PKD2 gene, and there is also infantile polycystic kidney disease, which is a autosomal recessive condition, but is much less common.
Okay. How do you think polycystic kidney disease was diagnosed in this gentleman?
So recently we have introduced screening programs for relatives of patients with polycystic kidney disease. However, given this gentleman's age, I think it's less likely that he has been involved in one of these screening programs, though it is possible. I think it's more likely that he was diagnosed via routine blood testing.
Okay, thank you. What type of dialysis has this gentleman been receiving?
So this gentleman has been receiving haemodialysis. The diagnosis of polycystic kidney disease would be more in keeping with haemodialysis. Also, the AV fistula, which is currently working and shows evidence of recent needling, indicates this gentleman is receiving haemodialysis. I think the use of peritoneal dialysis in this case is unlikely, as the bulk of polycystic kidney disease and the fluid that is required in the peritoneal cavity can cause discomfort to patients. Also, having peritoneal dialysis does increase the risk of cyst infection, which can lead to a number of complications.
Thank you very much.